Hi, I'm Dr. Dan Sindelar, and I'm proud to present Amy Doneen and Dr. Brad Bale, who are going to be presenting at the American Academy of Dental Practice Administration in March. And I'd like to ask them a few questions just so we can kind of get an idea of what they're going to be presenting. So what area are you going to be focusing on?
Yeah, well, our focus is always on preventing heart attacks and strokes and diabetes. And so there's a huge tie-in with periodontal disease. And we do have level A evidence now that periodontal disease is independently associated with arterial disease. And that's an extremely strong statement. It's hard to gather level A evidence. So any program, be it medical or dental, that touts itself as preventing cardiovascular disease would be remiss without addressing the periodontal association.
I'll expand on that, I guess.
Okay.
So one of the reasons we're excited to have the opportunity to speak at the AADPA, which is a practice administrative company looking at dentistry and clinical application of the science, we come at this from a medical side. So our goal is really to build bridges between the medical community and the dental community, and this opportunity we see as such an honor, and the ability to get in front of individuals who have the capacity to make it happen and apply the science to clinical practice areas that bridge those gaps between the medical and dental community. It really is our goal to make this real, make it practical, because as Brad mentioned, level A evidence can't be withheld. So we're excited to get the message out there.
Yeah, I can tell you we're extremely honored to have been invited by Dr. Joe Blaze to address this stellar group, because they can be very instrumental in driving the needed collaboration between the medical and dental field. We definitely need to develop an army of oral medicine specialists who can work with the medical providers that are concentrating on cardiovascular prevention. So it's a real honor to be part of that meeting. We're looking forward to it.
So one thing that Brad and I have noticed when we've had the opportunity to speak in front of the medical community is that all of the medical clinicians who practice cardiovascular disease prevention are asking us, asking their colleagues for a dental professional who understands and appreciates the oral systemic connection. What we realize as cardiovascular prevention specialists is that we can't do it alone without the dental community, and so we have to build these bridges and get the message out there. And all of these medical providers, physicians, nurse practitioners around the country who are running prevention programs are seeking out dental providers, dental hygienists, dentists, periodontists, general dentists, specialists who will work with them, and it's a mutual relationship. They need one another. We realize in medicine that the oral systemic connection is vital for long-term wellness, and the world of dentistry needs to be celebrated for their role in saving lives through heart attack and stroke prevention. So we really do need to make this happen, and we're excited for this opportunity.
Yeah.
Well, we're very excited to have you there, and I will tell you just from a personal standpoint, thank you both for not only your care, but also for the leadership and the education you've given me over the last 2 to 3 years. It's changed my professional career, so thank you very much.
Thank you.
Thanks, Dan.